Welcome to the Holistic Health Matters podcast, where it's all about maximizing your health potential in body, mind, and spirit so that you can pursue the abundant life more effectively. I'm your host, David Sandstrom, naturopathic doctor and biblical health coach, and this is episode number 4. All right, today we've got a guest on the show. His name is Dr. Mike Halan, and he graduated from Life Chiropractic College in 1995, and he's been practicing chiropractic in the Atlanta area since 1996. And he has seen thousands of patients over the years. He sees anybody from newborn infants to the elderly. And one of the features of his practice is he uses applied kinesiology. Dr. Mike, welcome to the Holistic Health Matters podcast. And I'd like to start things off by asking you to tell us something interesting about yourself that most people don't know.
Well, when I was 2 years old, I was hospitalized for pneumonia. I almost died.
Wow.
And I was kind of a sickly kid up until that point, and following that until about the age of 7 when I got under chiropractic care myself.
So what led you to seek out chiropractic care at the age of 7?
Well, my mom was seeing a chiropractor for a neck injury, and he noticed that I was kind of sickly looking. I had dark circles under my eyes. I always had a runny nose. And he asked if he could evaluate me, and my mom said, yeah, sure, you can take a look at him. So he identified some misalignments in my cervical spine that were the result of a forceps cesarean delivery, where the obstetrician had elongated my cervical spine and damaged it. So
wow.
I proceeded to get chiropractic care for the first time. And after just a few months, my health profile completely changed.
Wow. Wow, that's incredible. So I'm assuming that experience helped spark an interest in you in natural and holistic healing methods.
Yeah, it wasn't just that, but, my mom was still under that allopathic model. So when I would get a runny nose or what appeared to be a cold, she'd take me to the family medical doctor, and his solution was always a shot of antibiotics and a few days off of school. And it was a routine that never quite made sense to me.
Yeah, unfortunately, that's all too common, isn't it? Doctor just wants to see you for a few minutes and write your script and send you on your way. It's unfortunate, but that's the way it is. Remember the movie Back to the Future 2 when the older Biff went back in time and gave the younger Biff the sports almanac? And that set his whole future in a different light. If you could go back in time and talk to the younger Mike when you were first getting started in natural and holistic health, what advice would you give him?
Well, I would tell him to not try to fix everything on everyone. When I first got out of school, I was very enthusiastic and gung-ho to really change people's lives. And I didn't often listen to exactly what it is that they wanted from me. So I would try to involve myself in their dietary life and their exercise life and other aspects of their personal life. And it was only with the desire to try and help these people achieve true wellness. But I found over time that patients weren't very compliant with exercises I'd give them or dietary changes I would recommend. So after a while, I learned, I'm fulfilling a certain desire in the patients in terms of assistance for what they want, but they don't want me involved in every aspect of their life. And when I finally came to realize that, I stopped taking a lot of the burdens of practice management home with me. And I think it actually made me a better practitioner because I started to listen more and understand better what it is that patients wanted.
Wow, that's really interesting. So when you were at that point in time, were you frustrated thinking to yourself, why don't these people want to get better?
Yeah, it was very frustrating to me. Why weren't they as enthusiastic as I was? Why didn't they desire to know the information that I wanted to impart on them?
Yeah.
So it was a bit hubristic of me, but it really just came from a place of enthusiasm to get out there and make a change in the world.
Yeah. So I'm assuming that after you came to that realization and made those adjustments, that probably enhanced the effectiveness of your practice.
Yes, and I learned to discriminate what patients wanted to go to the next level and what patients were looking for information to better their lives and not just come in and have their pain resolved or, their symptoms modified.
Yeah. So I'm assuming you would do more listening and ask more questions, and then base your approach on what they said, what they told you.
Yeah, it teaches you to be a better listener. It teaches you to be a much better diagnostician.
Yeah.
And ultimately a better practitioner, because if I'm not giving a patient what they came in for, then, they're not going to continue under care, and they can't see the ultimate best possible result in what I have to offer.
So that's great, Mike. Thanks a lot. And Double HM friends, I just want to emphasize, when you do see a practitioner such as a chiropractor, what Mike is saying is it's going to help him out a lot if you communicate well and tell him exactly what your needs are and what you want. And that way he can tailor his approach to you as an individual.
Well, I'll tell you a cute little story that goes along with this is I've learned to ask very leading questions when doing health history, especially when someone doesn't put much in there when it comes to accidents and trauma. So if they don't indicate that they've been hospitalized, I'll ask them if they're sure that they've never had a hospitalization, never rode in an ambulance. And the reason I became aware that it was necessary to do this is I had been treating a patient for some time who was doing really, really well. And he offhandedly said, yeah, that was like when I had that knife in my head. And I was like, wait, excuse me? What? Your knife in your head? What, did I miss something? He says, yeah, I didn't tell you. He says, I got attacked and I had a knife sticking out of the top of my head. I had to go to the hospital. They had to remove the knife from my head. Unfortunately, there were no side effects. But so I learned then that you can't trust what patients write on a history form.
Wow. That's pretty amazing.
Yeah, in his mind, it wasn't germane to the reason he was there. But for me, it was very important information, and it kind of changed my perspective on what that patient's entirety of their issues were.
Wow, that is an amazing story and a good lesson for all of us. Thanks for sharing that.
Okay.
When I'm a fan of chiropractic, you know that. And when I tell people that they ought to consider finding a good chiropractor, I often tell them, not all chiropractors are created equal. They have various levels of experience, and they have various levels of capabilities and things that they're into. Chiropractors tend to specialize in a certain area, and a patient or a client has to find a chiropractor that's right for them. They might have to try a couple different ones before they find the right fit.
Yeah, and I like to say to patients, we're all a jigsaw puzzle, and different physicians have different pieces of that puzzle to help fill it in. And I've referred people to other chiropractors over the years who do work that I don't do because I thought it would be a better fit. And I've referred patients to all manner of specialists because I've identified either during a health history or during early phases of care that they need someone else's expertise.
Yeah.
And I'm completely open to working with people that have that expertise because I don't have all the answers. I just have a few of those jigsaw puzzle pieces.
Well, that's a really huge point. And the human body is so complex. I wrote the book, The Christian's Guide to Holistic Health. It's challenging enough to address our physical concerns. But when you consider that human beings have a mental, emotional component and a spiritual component, and those powerfully impact our physical vitality, there is not a chance that a single practitioner would have all the answers, correct?
Correct. Absolutely correct.
Yeah.
And a lot of people, and I'm sure we'll get into this later in the interview, they fall into the Western medicine model. But oftentimes using a general practitioner MD as the gatekeeper and the diagnostician to figure out what you need is oftentimes a mistake. And I guess we'll address that more in the interview in terms of the pitfalls of Western medicine and how people can get on a merry-go-round of drugs and that type of thing because they've entered into the wrong model.
Yes, absolutely. Yeah, we'll get to that in a minute. If somebody could only remember one thing about this interview, what would you like them to remember?
That a person's health is in their own hands. Socrates wrote about this, and many philosophers over the years, that we are our primary physician. Because although we have the ability to describe to someone the symptoms we're having or how we're feeling, we were given an innate analytical sense of how our body works. So listening to that innate intelligence inside us, which you could identify as God-given for those who subscribe to a more secular evolutionary worldview. You could describe that as a genetic superiority or genetic influence. But that innate intelligence and voice that you have inside you should guide every aspect of your life, of course, but it should specifically guide how you interpret how your body is working and the changes that you need to make. We know instinctively when given a choice between zucchini or broccoli versus a milkshake and French fries, we intrinsically know what our body needs and what our body should avoid. But we use our cultural mind to override those innate decisions, that innate voice, and we'll often make bad decisions. So listen to your body, let your body dictate what you need, and never take any physician's word when they say they know what you need. If that information is counter to what your innate intelligence is telling you, it's the wrong advice.
That's great advice. I love it. Yeah, it's always good to have a healthy dose of skepticism, isn't it?
Mm-hmm.
One of the things that I often hear, one of the criticisms of chiropractic is that, well, they're not real doctors, and there's a lot of quacks out there. So talk a little bit about what kind of education a chiropractor gets and what the licensure requirements are and that kind of thing.
Well, a Doctor of Chiropractic degree is a 4-year degree. It is dependent upon someone having a Bachelor of Science in Biology, so that the foundational information about biology, biochemistry, and physiology is there. We spend a lot more time than the MD does in their 4-year degree. We spend a lot more time with diagnostics and physiology. So if you have a chiropractor coming out of school versus an MD out of school, that chiropractor knows volumes more about how the body works than the MD does. Now, this wasn't necessarily the case at the turn of the century, but because the Western allopathic model is so in line with the use of prescription pharmaceuticals, the medical profession and medical schools have had to shift a lot of their curriculum to how to prescribe and how to deal with toxicology and interaction of drugs. They spend very little time on physiology outside of pharmaceuticals. They spend very little time on diagnostics compared to what they used to do. So instead of changing the curriculum and adding in, say, another year's worth of study to deal with pharmaceuticals and toxicology, they have trimmed away some of the most important components of the medical education to make room for that. And unfortunately, because the pharmaceutical industry is the largest donor to private medical institutions, they have a lot of say in what that curriculum looks like.
Yeah. Now, correct me if I'm wrong, Mike, but what I hear you saying is there's a time and a place for drugs and surgery, but using that as our frontline defense for health and wellness is probably not the wisest move.
Absolutely true. If, God forbid, a parent gets a phone call that their child has been killed in a car crash, it's time for a Xanax. But if someone is just experiencing that they're not as fulfilled in life as their neighbor, and on a daily basis they deal with a little bit of sadness, that's not the circumstance where somebody should be prescribed an anti-anxiety medicine or an antidepressant. Unfortunately, in our culture today, we all want to live this perfect lifestyle, and we also want to do it on an emotional level. So that's just one example of how pharmaceuticals are overused in our culture.
Yeah, the MDs, psychiatrists are MDs these days, and what they do is prescribe. They don't spend a whole lot of time talking to people about the example you just used. You're just feeling a little down, a little blue, so they walk out with a prescription instead of, let's talk about some of the whys and what you can do to change your thinking and more holistic, natural methods. They just jump right into the drugs, which is oftentimes the wrong approach.
So if I could circle back to your question about, what do people need to know about chiropractors? So when we come out of school, we have a very strong sense, given this 4-year degree in sciences with biology, and now this 4-year curriculum that is heavily, heavily engineered for a great understanding of physiology, biochemistry, biomechanics. If anybody understands how the body works and what the body needs from a natural standpoint, it's chiropractors.
Yeah. I couldn't agree more. It's absolutely true. Do chiropractors have to go through Are they required to have any continuing education to keep their licensure?
Yes, we're required to do 40 hours of continuing education every 2 years. Some people will do that 20 hours per year. Some people will knock it out 40 hours every 2 years. And the majority of that is new clinical information that has been either peer-reviewed, studied information in chiropractic care, physiology, orthopedics, or technique. How do we do our job on a daily basis? How do we adjust the spine? How do we evaluate the spine? How do we evaluate for other conditions that we either need to treat or refer out for? And then a much smaller component of that biannual education has to deal with changing laws and things that might affect us on a legal or administrative level.
Okay. So, Mike, I would imagine there's some people listening that have never been to a chiropractor but are interested. So, for that listener, could you tell them what chiropractic care actually is?
So chiropractic care is most famously known for treating musculoskeletal conditions. And we like to say that pain brings people in, but improved body function keeps them in practice. So if someone has a neck injury from an automobile accident or a slip and fall, if they experience chronic headaches, if they get a low back pain that mysteriously emerges out of nowhere, they'll often find their way into the chiropractor for the very first time. It's at that time we really educate them that chiropractic care is not about pain management or pain relief. Chiropractic care is about balancing the body so that it can work as it was designed to do. Your DNA has been engineered in a way to create this perfect machine that is the human body. But the human body is subjected to all types of insults and injuries throughout the course of a lifetime. We basically turn back the clock in dealing with those injuries and those insults. And those insults may be biochemical, those insults may be emotional, not just structural insults. And what those insults do to the body is they create nervous system stress and nervous system dysfunction. Now, chiropractors specifically look for something called the subluxation, which is a misalignment of a vertebra in the spine that is putting pressure on either the central nervous system, the spinal cord, or the peripheral nerves that branch out and communicate with every cell, every tissue in the body. When we can remove those impediments to the body performing at the level it was designed to do, that's when people improve. And not just their neck pain or their back pain. They start sleeping better. They start thinking better. Their memories work better. They have less stress, less anger, less depression, less anxiety. Their digestion functions better. Everything improves because we see those types of misalignments that we treat as impediments to the human body expressing itself, both its DNA and its spirit and its energy. And that's what chiropractic is really all about.
Great description. I don't have anything to add to that. That was great, Dr. Mike. Thank you for that. So if someone is interested in coming to a chiropractor, what type of ailment does chiropractic excel in? What would be your a chiropractor's strength area?
Well, we certainly excel in the musculoskeletal conditions that we talked about a minute ago. But people who are concerned about, people that are sort of looking at the Western medicine model of drugs and surgery and saying, you know what, that's not for me because that doesn't really promote wellness. I'm looking for wellness. I'm looking for my body to function at the highest level that it's possible. I'm going to CrossFit, I'm working out, I'm feeling strong, but I still don't sleep well. I still have digestive issues. I still have reflux. There's certain foods I can't tolerate. I'm not using the bathroom on a daily basis. I'm going to the bathroom maybe twice a week, and I know that's not right. I feel toxic because of that. Things aren't working in my body. I have a little bit of anxiety. My wife tells me that I'm too quick to anger, or my husband says I'm sad all the time, even though we have all these wonderful things in our lives. Any one of these types of conditions and a myriad more can be treatable from chiropractic if the root cause of these problems or a aggravating cause of these problems is nervous system stress. So chiropractors have been infamously misquoted over the years, saying that they can cure anything. That isn't what we say. What we say is it's quite possible that any symptom set that you're presenting may have its root cause in nervous system irritation or nervous system, a lack of nervous system coordination. get evaluated by a chiropractor, see if that's a component of the symptom set that you're dealing with. If it isn't, we'll find you the doctor that you need to see. But if it is, it's a non-invasive natural therapy and treatment plan that can completely change your life.
That's great. I'm just going to paraphrase you real quick here. Mike's going to maybe be a little bit simplified, but what Mike is saying here is you may have a headache and you can get a painkiller for that and we'll bring you some relief, but your headache is not caused by an aspirin deficiency. It's probably caused by, it absolutely is caused by something else. And a chiropractor can help do the investigative work to help figure out where the root problem is.
Yeah, right on the money.
All right, great. Is there anything that I shouldn't see a chiropractor for? Is there anything that's hazardous to go get chiropractic adjustments for?
Well, there's no reason to not go into a chiropractor's office, but oftentimes we will see a condition that it's best that we don't interfere with. If someone has just been in an accident and has an acute fracture of the spine, or has torn a ligament, avulsed a ligament from the spine, or anywhere else on the body that it would be our intent to treat, because that's why you're coming in. Some people occasionally come in with very advanced degenerative conditions that we're at a point where chiropractic would no longer be beneficial to that condition and could aggravate that symptomatology.
So what you're saying, Mike, is use some common sense. If you have an acute condition, especially something like a fracture, you might want to wait until the acute condition is over with and then go see a chiropractor.
Yes, we've had circumstances where patients have been in a car accident and they will call me 10 minutes after and they have pretty severe symptomatology. And I will tell them, go to the emergency room.
Yeah.
Take the ambulance ride, go to the emergency room if you can, get evaluated there. Because if you do have an acute injury that requires medical attention, that's what you do first. And then come in and see me afterward. Yeah. And we'll deal with the aftermath of that injury that was not something that you needed ER care for.
That's great advice. I often tell people allopathic medicine it shines in the emergency room. You get busted up in a car accident, man, you will be well served going to the emergency room. And when the emergency is over, however, you're better served by natural and holistic methods. And chiropractic is absolutely right along those lines.
Yeah, I have nothing but respect for those folks that work in emergency rooms and emergency medicine, paramedics, our battlefield physicians that work on the front lines in any war zone. These people deal with the real emergencies. Chiropractic is not for emergency medicine.
Yeah.
Chiropractic is to help you rebuild your body and express 100% of your potential. That's what chiropractic is about.
Excellent. What would you say to someone who is, maybe they've been to a chiropractor and they didn't have a good experience, they didn't like getting cracked, and they're afraid to go back and try somebody else?
Well, every once in a while I'll hear a story from somebody who has had a negative chiropractic experience, and I would find that more often than not, my assessment of those stories comes down to one thing, and that is lack of education passed on from the chiropractor to the patient. If a chiropractor does a very good job of educating a patient about what their problem is and what is required to help them solve that problem, we usually don't have these types of negative experiences. But when a chiropractor moves too quickly, they bypass the education component of the initial consultation, and a patient doesn't have a good understanding of the nature of their problem and what it's going to take to solve it. That's the recipe for a bad first chiropractic experience. If someone says, I don't like to get cracked, or doesn't see the value in something being cracked, I know right away that the chiropractor hasn't explained to them that sound associated oftentimes with the chiropractic adjustment is a benign event that we call a vacuum phenomenon. It's just like when you crack your knuckles, and I know that makes some people cringe, but cracking your knuckles isn't going to lead to arthritis, and is just a byproduct of the realignment of a joint that is misaligned and fixated. The popping or cracking doesn't always happen, but when it does, there's often a really beneficial side effect is endorphins are released around the joint, and there's often immediate relief that follows from those endorphins. So the crack is not a bad thing, is often a good thing. But if people just can't get past that because it's just too creepy for them, there are low force techniques or instrument aided adjusting techniques that are very, very effective that bypass that cracking or vacuum phenomenon. So the crack shouldn't keep anybody out of the chiropractor's office.
All right, good stuff. I can testify that, and you know this is true with me, Mike, that occasionally when we are tuned into that innate intelligence we were talking about a moment ago, sometimes when you get that adjustment, you feel an immediate tension relief. And you say, that is exactly what I needed. And it's a terrific feeling. It really is. So, Dr. Mike, I'd like to shift gears just a little bit. And we often hear people talk about our bodies as bioelectrical machines. What does that mean to you? Could you address that a little bit?
Yeah, sure. We are a millivolt electrical model, the way that our nervous system works. So there are chemical reactions that will actually create energy. And that energy from those chemical reactions allows nerves to conduct information from one neuron to another neuron. The signals sent from the brain that will eventually reach, say, the hand or the heart, it's necessary to have these biochemical electroconductive events to occur. And because we are this millivolt electrical model and we vibrate and share energy with our environment, it's important that we don't have anything standing in the way of our ability to do that, either to conduct nerve impulses for daily function, or that stands in the way of us sharing information with our environment. I'll give you an example. When you meet someone for the first time and you shake their hand, there is communication occurring between your body and their body. Now, you may not be aware of that communication on a conscious level, but on a subconscious level, your body is interpreting information from that other person. Same is true when you pet the dog. You are sharing information. So that's my perspective on how we're this millivolt electrical system.
All right, very good. Thank you for that. I know that you use applied kinesiology in your practice, and it's my experience that it can be very insightful. In fact, I'm going to share a quick story. You might not even know this, Mike. I don't know if I've shared this with you before, but I came to you a couple of years ago, and I had been to my regular family practice doctor a couple weeks earlier, and he did my annual blood workup. And one of the only thing that came up was that I had high homocysteine, and I knew that from the lab work. I came into your office, and you did some muscle testing on me, and you said, "Oh, there's something going on with the blood. Let me see. Oh, you have high homocysteine levels." So you were able to figure that out without any lab work right in the office. So talk to the audience about what applied kinesiology is and what it can do.
Well, because we're this millivolt electrical model that works on biochemical reactions that create energy, there are diagnostic approaches that allow a practitioner such as myself to gain information about a patient. I utilize muscle testing that originated in applied kinesiology based upon something called autonomic downregulation of the nervous system. Your listeners don't need to remember that term, but essentially what it is we can stress the body or we can stimulate in the body in a way that it will create systemic weakness. So if I were to, say, establish a strong muscle test, I had you hold your arm out and I tested your anterior deltoid and it was strong. If I blew cigarette smoke in your face or had you smoke a cigarette yourself, then that muscle would not be able to sustain a normal contraction to resist the pressure that I put through it. So this is the methodology of muscle testing through applied kinesiology. So I can use this to access information from the acupuncture meridian system. I can use it to not only diagnose nutritional deficiency, but I can use it to dose you for nutritional supplementation. It can be used on an emotional level to help people deal with stored away emotion that may be a roadblock to someone being able to manage their emotional life. So the opportunities for use of a technique like this really are endless. And some people debunk it and like to call it voodoo because it doesn't make sense to them. But this mechanism, and it's why I gave the title for it earlier, is very, very well documented and has been used in lots of different disciplines, not just chiropractic and applied kinesiology.
Yeah, that's a great explanation, Mike. And, I often hear people say, well, that sounds like quantum physics, isn't it? And I say, yes, it is. And they say, well, I don't believe in quantum physics. Well, then I ask them, have you ever listened to an FM radio? Well, sure. Well, do you realize that radio with its antenna is capturing energy that's traveling through the air, invisible energy, and it's harnessing it through the antenna, through the amplifier into the stereo and out to your speakers and duplicating the sound that originated in a studio, maybe in another country.
Well, when Albert Einstein postulated that energy and matter were the same thing, just different phases, everybody thought he was nuts, right?
Yes.
And we now know that not only was he not nuts, but he was decades ahead of his time in terms of his thinking about these issues. So quantum physics is obviously a thing. Were it not for an understanding of quantum physics, we could not have sent a man to the moon and returned him back. We could not communicate with the Hubble telescope or with satellites that we've sent out to explore the cosmos. The technologies that we enjoy on a daily basis, including that smartphone that we enjoy looking at, many of those technologies have their basis in a higher understanding of physics and quantum physics. So it's there, it's real, whether people believe in it or not. And this understanding that matter and energy are the same thing in different phases also gives us insight into energy medicine. Is all energy medicine or things that fall under the banner of energy medicine legitimate and tested? Not all of it is. If your practitioner gives you a crystal and tells you to take that crystal home and set it near the bed and absorb the energy or the modification of energy from that crystal, very, very hard to quantify that as something both real and effective. So there's a lot of hope and trust put into that sort of a recommendation. With chiropractic and applied kinesiology, there is immediate change in the physiology of the body and how it works when we do what we do. So there is an immediate quantifiable and qualifiable result to the work that we do. And it's what kind of separates it from this broad category of energy medicine. We're in there, but we are distinctly observable and provable.
Excellent. Good stuff. This is really good stuff. I think people are going to find this very interesting. So just to recap, what Mike is saying here is chiropractic care is useful for all kinds of things, although not a panacea. If we have a chronic issue, we are well served by seeing a chiropractor and letting them do some of the investigative work, see if we have a body mechanical issue that can be addressed through chiropractic. And if the practitioner can help you with your sleep, well, we do a lot of our healing and repairing while we sleep. Just that one thing alone can make a massive difference in your health and wellness. So to wrap things up, Mike, do you have a favorite book that you might recommend for the audience?
I think a real groundbreaking book, or a book that can help people really shift their consciousness, is a book by David Hawkins called Power versus Force. And Power versus Force doesn't specifically get into chiropractic and what we do, but Power versus Force touches on quantum mechanics. It touches on, above all things, consciousness. How we see the world, how we see our bodies, how we see our purpose in life will dictate for so many people what their priorities should be. And Power versus Force is one of those books that really changes the mindset for people who read it. I've lent it out probably 50 plus times over the years to patients, and I've never had anyone bring it back who actually read it that didn't say it was one of the most important things they had ever read. Wow. I wish I could go into more detail about what it's about. I know you have familiarity with that book. But David Hawkins' writings, and specifically that book, really have an opportunity to change someone's entire consciousness.
Excellent. Thank you for that. If it's okay with you, Dr. Mike, I'd like to ask one more question. Oftentimes I get asked, Dave, what is the single most important thing I can do to improve my health? What's the one thing I can do? Where do I start? So what would you say to that question?
I would say that people should start thinking of sleep as a nutrient. If I wanted to deprive someone of food, their body would last a long time. They could live up to 30 days without food. If I deprive them of water, they're going to live about 3 to 4 days. If I deprive them of sleep, it's not uncommon for people to have some type of catastrophic failure that leads to death within 3 to 4 days. So you could go without water longer than you could go without sleep. But if you think of sleep as a nutrient and make it one of the primary things that your body is getting, your body's going to function on a much better level. And I can't tell you how many times I've encountered people that they're doing CrossFit 3 times a week. They've increased their water intake. They've stopped eating processed foods and are consuming more fruits and vegetables, but they're still only getting 4 to 5 hours of good sleep per night. Think of sleep as a nutrient. Your body requires 3 REM cycles, rapid eye movement cycles, per night. That's the dreaming phase of sleep. It requires 3 per night for you to do all of the repairs necessary from just the activities of daily living. It also requires that amount of time to save information in your brain's RAM and save it to the hard drive. So if you're not getting enough sleep, you're not repairing. You're literally aging faster than you need to, because there's more demolition than construction going on. You're also not retaining the information that you may have invested a lot of time and expense into acquiring, because it's not being saved to the hard drive, meaning when you need it later, it's not going to be there. So think of sleep as a nutrient, in many ways more important than the food that you eat or the exercise that you do. And if you make sleep a priority, that's going to change your life dramatically.
That's awesome. Thank you, Mike. That's really, really good advice. So how can our listeners get a hold of you? If someone wanted to come see you or talk to you, how could they get a hold of you?
Well, you can find out more about me on our website for our office, halanchiropractic.com. That's HALAN, chiropractic. The phone number for our office is 770-609-9374, and we have folks there that can answer most of your questions if you've not been to a chiropractor before. And I'm also always happy to get on the line and field any questions. It's not uncommon for patients to call us when they're on the road or have other health-related questions and can't get in for a visit, and I'm happy to make that time for them and fulfill my primary role of educator.
Okay, thank you. Your number one more time?
770-609-9374.
All right. Well, thank you, Dr. Mike, once again for being so generous with your time and sharing your incredible depth of knowledge with the HHM community.
Thanks, David.
And remember, for more, you can always go to my website, davidsandstrom.com, and search for episode number 4. And there you can find a full transcript of the conversation. It's downloadable if you want, as well as links to any of the things we talked about. And if you'd like to reach out to me, you can leave a comment there as well. And as always, I'll talk with you next week. So until then, be blessed.